Now, the next is about the marma and the details of the marma. अर्थात प्रत्येक मर्म निर्देशं शारीरं व्याख्यास्यामः यथोवाच भगवान् धन्वन्तरिः. The word marma itself is again has a very broader meaning, and in different contexts it would have a different meaning. The word marma otherwise usually is defined as the marayantit marma, something which produces a fatal effect or a very severe effect. Now, from the Sushruta's point of view and Charaka's point of view, there is a primary difference in the concept of marmas to a certain extent, not very gross difference. In the primarily, the vital points, the something which introduces a wide spectrum impact on the body, on the physiology of the body, is such a condition is such a point of the body is considered as marma. Now, these vital points, from the current terminology, current science point of view, one of the important aspects in the current surgical point of view is what we call as the applied anatomy. See, each and every part of the body, each and every tissue and organ of the body has a certain capacity to react to the stress of injury, trauma, in a different manner. And this is impacted by the surroundings in which that organ or the tissue is located, like a liver which is located in the abdomen. Now it can sustain the trauma in a horizontal direction better than in a vertical direction because of the suspensory ligaments. The suspensory ligaments hold the liver in such a way that a horizontal trauma, a blunt trauma in the horizontal direction can be tolerated better than the other. Or when there is a blunt trauma in the intestines, the points where the mesentery is immobile, or where the mesentery becomes movable and immobile at that junction, that's the point where it gets injured. Like when there is a blunt trauma, the body of the stomach escapes the trauma easily, whereas the duodenojejunal junction, where it becomes retroperitoneal, that's the point where it gets injured more frequently. Or at the ileocecal junction, there again it gets impacted more frequently. Now, this kind of a knowledge is used in the traumatology care, trauma care, for benefiting for the benefit of the patient, where you can search for the location of the injury quite easily. That's one. That's what we call as applied anatomy. Now, the whole branch of the surgical discipline is about the applied anatomy, and in that applied anatomy, you will be studying about the impact of the trauma on the different parts of the body, and how that impact of the trauma changes due to the surroundings or the interrelationship between the organs and the functions of the organs. That's one of the important points. And whatever Sushruta has mentioned in the context of marma has a bit of that part, that component. But more importantly, the marma which is mentioned in Sushruta is about actually applied aspect of the warfare injury. See, in the olden days, there are even now many of those martial arts technologies like judo, karate, and so on. They have that kind of a technique, even Kalaripayattu in Kerala. Now, all of them, they recognize certain sensitive areas of the body where the trauma can produce a injury of any sort, can produce a significant deformity to make the other person, opponent, debilitated, so that the attack will be effective. To make the attack effective, certain points of the body were recognized, and that's one of the applied development of the warfare technology. Now, Sushruta has referred to the marma not from the point of view of getting skilled in the warfare technology, but because the people who get injured in those vital areas, they would be visiting the physician. A physician has to take care of those. So he need to identify those and the impact of the complication, impact of the injury to those vital parts of the body were to be studied. So hence, whatever we see in the related to the marma in Sushruta is related to the trauma produced in a warfare injury and where the vital organs are developed. In Charaka Samhita, the main stress is about the three marmas, the major vital areas, Basti, Shirohridaya, the areas of the brain, heart, and the abdomen, bladder. Basti in the sense not only the bladder. Or when we say now a vitals of a person, now whenever we examine a patient, we use the word like vitals are normal. Vitals in the sense where You will be studying whether the patient is conscious or not, whether he responds to the stimuli or not, whether his breathing is proper or not, and then whether his bowel functions are normal or not. If these three are the normal, we consider that vitals are normal or vitals are okay. Now that's exactly what Trimarma of Charaka Samhita refers to. Whereas the 107 marmas also are referred to Charaka, but that's not going into that's not given in the same detail as that of the Sushruta Samhita. Sushruta Samhita, when the discussion of the marma is referred to that the impact of the warfare and how to deal with the patients of the warfare. Now, in the present day situation, you will have lots of people or lots of publicity about the Marma Chikitsa as a branch of Ayurveda. Now, virtually, that kind of a Marma Chikitsa, idea of treating a patient based upon the Marma concept, is not a original Ayurvedic concept. Of course, there are people who do that, and it's rather that kind of a concept where a surface of the body, by putting some pressure or some impact on the surface of the body, physiological functions of the body can be modified or pathology can be cured. That kind of an issue is a derived aspect from the Chinese medicine. And of course there are many other native medicines elsewhere also. You have that kind of an approach where the theory is that the body is on the surface of the body, the vital organs of the body or visceral organs of the body are represented, and by putting the pressure on certain area, either putting the pressure or by applying the heat or pricking with a needle over the area and so on. So that can produce an impact on the physiology of the body, and the functions of the organ can be modified. And that kind of a brand, these techniques are also quite popular in the world, like acupressure, acupuncture and so on. And lots of varieties of such techniques are being practiced and they are quite popular. And many of such principles are adapted to the concepts of the Marma here in Ayurveda. And there are a good number of people who are popularizing that Marma Chikitsa in Ayurveda. But originally, from Sushruta Samhita point of view, the purpose of Marma is not about that kind of an approach of treating with the Marma Chikitsa. That's all the point. I am not criticizing that Marma Chikitsa and so on, but we need to have a clear idea when we read Sushruta Samhita about the basic concept. So, basic idea of Sushruta Samhita, Marma in Sushruta is about identifying the impact of the trauma over the body and the managing that with an idea of planning for the management of that. The Marma idea is necessary, and it's actually a branch or rather applied aspects of the warfare technology prevailing at that period. Now, then the another important point is whenever there is a trauma or injury to the body, the impact of the injury also would be depending upon whether the trauma is a blunt trauma or a penetrating trauma. And when it is a blunt trauma, how much is the impact, like the momentum of the trauma, type of the weapon or type of the instrument which is used for that producing the trauma, and so on and so forth. And hence, to generalize the impact of a trauma based upon one specific anatomical area of the body also is not totally, absolutely correct. Rather, you need to consider the type of the trauma also, the type of the trauma and the momentum and so on. The other impact of the trauma also has to be considered. Now, but when we go into the description of what we see in Sushruta, you will find the differences of that penetrating trauma and the blunt trauma. In the blunt trauma, the high velocity blunt traumas or low velocity blunt traumas, these kind of the differences are not to be seen, not seen as such, whereas in the current traumatology principle, we need to consider those issues also. So that's about certain issues related to the Marma. Now we directly go into what Samhita has discussed about the Marma. Saptottaram Marma Shabda. There are 107 Marmas. Tani Marmani. Panchatmakani Bhavanti. Tadyata, Mamsa Marmani, Sira Marmani, Snai Marmani, Asti Marmani, Sandhi Marmani Jeti. Nakhalu, Mamsa Sira Snayasti Sandhi Vitirekena, Anyani Marmani Bhavanti, Yasmat Moglabhyante. Now, the types of the 107 marmas are classified as Mamsamarma, Siramarma, Snayamarma, Astimarma, Sandhimarma. And according to Sushila, there is no other sixth variety, it's only the 5 varieties of the marma are there. Now, very interesting. Now, when we go into the details of the marma, you will find this issue also. But I think it's justified if we refer to that issue now itself. See, though Sushila has considered as Mamsa marma, which is often translated as the areas of soft tissues, injuries to the soft tissues. Sira marma as a vascular injury. Snaya marma again the soft tissues like the suspensory ligaments. And obviously, the word meaning would be suggesting same asti, the bones, sandhi, the joints. Now, if you look at the lakshanas of these marmas, individual marma viddha lakshanas, when you go into that, you will see that many of those marmas which are categorized as mamsa marma, they may not be having the muscular area, or the sira marma may not have that kind of a vascular structure. But the impact of the injury of a mamsa marma or a sira marma would be depending upon the type of the trauma. See, Siramarma usually is suggestive of, rather, the clinical presentations look like a penetrating trauma where the blood loss is more. Whereas the Mamsamarma and Snayamarma, these suggest about a stress injury where the soft tissues are stressed and torn. A deep tear of the injuries are more, it's not a very obvious definition, but I am suggesting that, and we will have that more clarification when we go into the Marma Viddha Lakshanas, individual Marma Viddha Lakshanas. There again I will refer to these issues. But now the primitive idea which you have to keep in mind, Mamsamarma, Snayamarma suggest about the tear injuries where the tissue is torn due to the stress, like another type of the trauma would be, other than that of the blunt and the penetrating trauma, another type of the trauma is a tear injury, stress injury. If any organ is pulled apart, stretched apart, then there could be a trauma, and more of the lakshanas, majority of the signs of mamsa and the snayamarma would be referring to that part, that type of injury. Astimarma and Sandhimarma are somewhat they refer to, or rather they are presented as the impact of the blunt trauma. Now, when I say this, that's not a very obvious or very objective this differentiation, but we can derive certain of these conclusions when we go into the lakshanas of marma viddha lakshanas in due course of time as we go into the discussion. So that's one of the point which you have to keep in mind. Then the numbers of these marma are tatra ekadasha mamsa marmani, ekachatvavinshat sira marmani, saptavimshatihi snaya marmani, ashtav asti marmani, vimshatihi sandhi marmani cheti. Now the numbers are 11 mamsa marma, 41 sira marma, 27 snaya marma, and 8 asti marma, 20 sandhi marma, and saptottaram marma shatam. Now in Charaka Samhita, the point referred to is again the same like सप्तोत्तरं मर्मशतं यदक्तं शरीरसंख्याम् अधिकृत्य तेभ्यः मर्माणि बस्ति हृदयं शिरश्च प्रधानभूतानि वदन्ति तज्ञाः. In Charaka Samhita, those 107 marmas are referred to. Hridaya, Shira and the Basti are considered as the Pradhana Marma, and the whole chapter is Trimarmiya related to the 3 marmas. And the big reasons are प्राणाश्रयात् तानि हि पीडयन्तु वातदयो असूनपि पीडयन्ति तत्संहितानाम् अनुपालनार्थं महागतानां शृणु सौम्यरक्षां. सप्तोत्तरं in Charaka Siddhi again the same is referred to. सप्तोत्तरं मर्मशतम् अस्मिन् शरीरे स्कन्धशाखा समाश्रितम् अग्निवेश त्रैषाम् अन्यतमपीडायां समधिका पीडा भवति चेतना निबन्धविशेष्यात्. तत्र शाखाश्रितेभ्यो मर्मेभ्यः स्कन्धाश्रितानि गरीयांसि शाखानां तदाश्रित्वात् स्कन्धाश्रितेभ्यो हृद्बस्ति शिरांसि तन्मूलत्वात् शरीरस्य. Now again both these are referred to from the point of view of stressing upon the importance of the vitality of the organs of the body and the whole life sustenance. When we say that the impact of the injury and resulting in the non-survival complications or which cannot sustain the life of the person, it's mainly related to the 3 vital organs of the body, and the 3 vital organs of the body are nervous system, cardiovascular system and the urinary system. These are the 3 major vital systems of the body. That doesn't mean that other systems do not have a importance, but we even now consider these as the 3 vital systems of the body which are absolutely necessary for the sustenance of the life, and where the impact can produce a short duration or a impact can be quite critical or fatal complications can occur within a short period, and that's why these are given more importance as such. And the basic idea of our Ayurvedic philosophy is these are the areas where the prana is located. तेषाम् एकादश एकस्मिन् शक्ति भवन्ति एतेन इतरशक्तिबाहु च व्याख्यातो उदरवरसोः द्वादश चतुर्दश पृष्ठे ग्रीवां प्रत्युर्ध्वं सप्तत्रिंशत्. The location of the 107 marmas are 11 in one shakti, that's one lower limb, and एतेन इतरशक्तिबाहु च व्याख्यातो. Similarly, the lower and upper limb also have, each of them would have 11. Udaravarasoh dvadasha, over the anterior part of the chest and the abdomen. Udara and uras. Chest and abdomen are the core part of the body, has a 12 Chaturdasha Prishte on the posterior surface of the same area, have 14 Grivam Patyurdam. Over the head and neck, the Saptatrimsha, the 27 marmas are identified, and their names. Now we will go into the individual marmas in detail, so just casual reference of the name. Tatra Sakti Marmani, Kshipra, Talahradaya, Kurcha Shira, Gulpa, Indrabasti, Janu, Ani, Gurvi, Lohitakshani, Vitapam Cheti, Yetena Itara Sakti Vyakshatam. उदरवरुसस्तु गुद बस्ति नाभि हृदय स्तनमूल स्तनरोहित अपलापानि अपस्तम्भवति. पृष्ठमर्माणि तु कटीकतरुण कुकुन्दर नितम्ब पार्श्वसन्धि बृहति अंशफलकानि अंसौ चेति. बाहुमर्माणि तु क्षिप्र तलहृदय कूर्चशिर मणिबन्ध इंद्रबस्ति कूर्पर आनि ऊर्वी लोहिताक्षाणि कक्षधरं चेति. एतेन इतरबाहौ व्याख्यातः. जत्रुनः ऊर्ध्वं चतस्रो धमन्यो अष्टौ बातकाः द्वे कर्काटके द्वे विधुरे द्वे फणे द्वौ अपाङ्गौ द्वौ आवर्तौ द्वौ द्वौ उत्क्षेपौ द्वौ शङ्खौ एका स्थपनी पञ्च सीमन्ताः चत्वारि शृङ्गाटकानि एको अधिपतिरिति. These are the names of the marmas. We will be discussing or referring to each of these marmas in detail, so we will not waste much time now. Now again, further these marmas are subclassified based upon the issue like Mamsa Marma, Sira Marma and so on. As I just referred to earlier, the Mamsa Marma Lakshanas are mainly referred to the stress injuries. And the possibility of the stress injuries, they tend to occur in Talahridaya, Indrabasti, and Tala, Hridaya, Indrabasti, Buddha, Stanarohitani, Mamsa Marmani. Nila, Dhamani, Matraka, Shrungataka, Apanga, Sthapani, Hana, Stanamula, Apalapa, Apasamba, Hridaya, Nabhi Parshva, Sandhi, Brihati, Lohitakshani, Siramarmani, Ati, Vitapa, Kakshadhara, Kurcha Basti, Kshipra, Amsa, Vithura, Mukshepaha, Snai Marmani, Katika Taruna, Nitamba, Amsapalaka, Shankhastu, Asti Marmani, Jan Kurpara, Simanta, Adipati, Gulpa, Manibanda, Kukundara, Avarta, Krakarika, Steve, Sandi Marmani. Now, these again also suggest about the possibility of the type of the injury. A possibility of a penetrating injury are more in the areas of the Siramarma. Possibility of a blunt trauma are more in the context of Snaimarma and Mamsamarma. And possibility of the stress injury are more. And this has to be considered in the presence of the partner concepts of the Sushrutas period and so on. In the present test traumatology principle, we do identify the possibility of these traumas mainly in the context of road accident. In the road accident injuries, vehicular accident injuries, these kinds of the trauma are very detailed. In the traumatology, you will find very detailed issues about the possibility of the type of a stress injury or a blunt trauma or a penetrating trauma, and their incidences in the specific locations of the body also are well studied, and that's one of the major chapters of predicting the possibility of injury in a patient of trauma. And this kind of detail is maximum in case of is available in the maximum quantity in case of the road accident or vehicular injuries. Whereas the warfare injuries, you may not get the same amount of the detail. The reason is simple. the type of the trauma patients whom we treat now, and majority of them are the vehicular traffic accidents. Warfare injuries may not be to the same extent as that of the social spirit. So as the time changes and as the lifestyle changes, the type of the source of the injury and the type of the injury would change, and hence certain of those basic approaches, the details of those basic approaches may change, but the basic concept of assessing a patient of trauma and possibly having some clues to predict the possible nature of the trauma are the basic idea of the traumatology principles. That's what we have to consider. Now, locations of these marmas are in general are located as such, and this kind of diagrams are available now, and it's a very popular issue. So we will not waste much time on that part. The naming of these marmas at these different locations are now very common, and they are that kind of information is available everywhere. Now, the other impact of these also, the type of the classification of the marmas also are based upon the consequences of the injury, like whether they may produce a immediate vital complication or a delayed complication and so on. And based upon that, they are classified into 5 types. Tani etani pancha vikalpani bhavanti tadyatha sadya pranaharani kalantara pranaharani vishalyaghnani vaikalyakarani रुजाकराणि चेति तत्र सद्यप्राणहराणि एकोनविंशतिः कालान्तरप्राणहराणि त्रयस्त्रिंशत् त्रीणि विशल्यघ्नानि चतुश्चत्वारिंशत् वैकल्यकराणि अष्टौ रुजाकराणि इति. Now, the impact of the injury to the body would be like either sadyapranharani, where it can produce immediate death. Now, when we say immediate death, that's again would be depending upon not only about the location of the injury, it also is depending upon the severity of the injury and how the injury has occurred. Now, again quite important, many of the organs of the body which were considered as Satya Pranahara Marma, like Guda, Bast, or the Hridaya, now with the surgical scope, with the available facilities of the surgery, you can remove the bladder, you can transplant the heart can be transplanted. So, to consider any area as a Sadhya Pranahara may not be true in the surgical context, where the injury is a controlled injury. Whereas, all the descriptions which are mentioned in the Samhita are related to the uncontrolled injuries, traumas which occur in a war field or maybe the other way, the accidents, not the surgical injuries which can occur in the surgical field. In a surgical theatre, when a surgeon injures the tissues, he injures the tissues based upon the knowledge of the anatomy, and the complications which can occur, they also are known to him, and hence those injuries are called as controlled injuries. The surgical injuries are considered as controlled injuries, where the impact of the trauma may not be the same as that of the blunt trauma. Whereas a uncontrolled injury which occurs in in an area where the whole situation is not easily predictable, naturally the impact would be different. So, concepts of that Sadhya Pranahara or Kalantara Pranahara may not be exactly the same applicable in case of the surgical situation, though from the surgery point of view, it's quite important to avoid such complications. Now, see, Sushruta has referred to the marma as one of the most important part of the knowledge which a surgeon needs to know. Surgeon needs to know from the point of view of preventing a possible serious complication because of the complexity of the anatomy of an area. Marma would have some complex anatomy where multiple types of the structures are rather closely related, and due to that interrelationship of the different structures of the body and organs of the body, they are considered as the critical or vital areas. And whenever you do the surgery in such which we now use the word surgically sensitive areas of the body, we use the word surgically sensitive areas of the body, surgically sensitive areas in the sense where the possibility of a collateral injury are more and where you need to be extra careful. You need to safeguard certain of the structures, like in inguinal hernia. When you open the inguinal canal, saving the inguinal nerve is one of the important issues. You need to identify the inguinal nerve and then locate it and save it. Otherwise, if you just go on cutting through, the inguinal nerve may be injured, which can produce a permanent loss of sensation in the inguinal area. So on and so forth. Now, this is just one example. Each and every surgery and each and every incision, you will have such a detailed issue of which of the components are to be taken extra care and what are the possible complications can occur. And this kind of a detailed issue is a part of every surgical technique. And whenever Sushruta refers to the issue of Satya Pranahara, Kalantar Pranahara, that fact has to be kept in mind. Like whenever you have a surgical injury or an access to an organ by a surgical incision, that may not be having the same consequence of an uncontrolled trauma. So this fact has to be kept in mind. Then as far as the Rujakara and Vaikalyakara, now this also is true as such from the point of view of whether you have a facility of treating such patient now or not. In the current situation where you have many technologies of treating the patients, newer technologies have come up. The major complications of the trauma, the most important complications of the trauma is the infective complications. Those infective complications can be more effectively treated than what Sushruta could do with the facilities available at that time. And hence that possible deformities and the possible pain and related issues, they can be better managed now. And many of those descriptions like a permanent deformity can be avoided with the current technology. So we need to keep this also in mind, like some of those complications like Rujakara and Vaikalya, they are related to the issue of improper or rather the type of the treatment, the facilities of the type of the treatment available in Sushruta's period and compared to the facilities available now, the facts may not be the same, the incidents may not be the same. But of course, it's true that certain of the injuries, they have a higher risk of getting infected, and still in the present day situation, because you have a more effective anti-infective remedies like antibiotics and so on, and the technology of identifying these organisms which can produce the infection, many of these complications can be more effectively prevented, and hence the gravity of the issue may not be the same as what Sushruta has said. Then Vishalyagna is a very unique idea or unique concept of the marma, where a foreign body which has got intact, if it is removed, it can produce immediate complication. If it is not removed, it can produce it may allow the patient to survive. Now, this kind of an issue also has certain significance from the current surgical point of view. Current surgical point of view, we do not have such a specified areas of the body where a foreign body can be or has to be kept as such. It should not be removed. That kind of an idea is not there. Rather, the idea of producing a minimal injury when there is a foreign body is the basic idea of the surgical approach. This part we have discussed in the Suprasthana when we discussed about the Ashtavida Shastra. I have referred to that issue, like whether a body in the Shalya Nirharanadhyaya, in the Anavabhuta Shalya and Avabhuta Shalya Nirharana Upaya chapter, where again we have discussed these issues. Like you need to have certain special techniques of removal of the Shalya or foreign body and minimize the trauma. There you may need some ingenious techniques, like we have referred to a hook and in the context, and that hook, or maybe this safety pin in the gastrointestinal tract, getting it closed and so on. That's all the point which we have discussed in the Avabhuta Shalya Nirharana chapter there. So if you refer to that, you will have more detail about that. So that's one point. And then the possibility of allowing a foreign body left over in the body also is the other way. Like suppose the condition of the patient is such that a complete removal of the foreign body may not be possible at that level, and most of the times it depends upon the surgical fitness of the patient as well as the certain qualities of the foreign body. Certain qualities of the foreign body, like which are not irritant, like a bullet. See, bullet is a metallic object and by the time it gets entered into the body, it's heated to the maximum extent, and chances of septic complication will be lesser. So if a bullet is left over in the muscles, where the other nearby vital structures like a nerve and vessel are not compressed, you may leave that bullet as such. So you'll have many of the people who live with the bullets in their body, Loha Purushas are there. Or it also, like in case of a impact, this implant which is kept in a surgical practice, like in orthopedic surgery, we use the metallic implants. That metallic implant kept over in the area can be kept infinitely, maintained infinitely without producing the complications. So these have certain basic reflective these concepts of what the Vishalagna says, but I am not saying that the concepts are the same. So there is a lot of difference between that idea of a Vishalagna and what the current surgery would be seeing as such. Now, the same complications which are discussed here again are in terms of which are the Sadhya Pranahara Marma and which are the Kalantara Pranahara Marma. The differentiation are based upon their type as such, as Sushruta has mentioned. Shringatakani Adhipati, Shankhu, Kantasira, Budam, Hridayam, Bastinabhyo, Gnanti, Sadhyo Hatanija. The Sadhya Pranahara Marma, Shringatakamarma, Adhipati Marma, Shankha, Kanta, and Guda, Hridaya, Basti, Nabhi, etc. Then Vaksham Marmani Simanta, Dalak Shikra, Indravastaya, Katika Sarunasandi, Pashajo, Bhratijaya, Nitamba, Vichitani, Kalantara Haranito. The marmas which are in the thoracic area, Simanta, and the Indravasti, Katika Saruna, and Pashasandi, Brihati, Nitamba, these are the Kalantara Pranahara. Utkhepo Stapani Cheva Vishalagnan in the Dishes, the Lohitakshan, Jano, Upi, Kurcha, Vitapakurpara, Kukundare, Kashadare, Vidhure, Sakrikatke, Amsam Sapalaka, Apanga, Nile, Manye, Panon Tatha, Vaikalya Karnanyahu, Avarto, those say that the Vaikalya Karamarma are the Ukshepa Stapani, Vishalak, there Ukshepa and Stapani are the Vishalakmarma, Lohitaksha, Jan, Gurbi, Kurcha, Vitapa, Kurpara, Kukundara, Kakshadara, Vidura, Krikatika, Amsapalaka, Apanga, Nila, Manya, Pani, these are Vaikalya Karma. Gulfo, do Manibando, Dve, Kurchu Shiram, Jakarani Jani, Astave, and Butimana. These are the issue of the which produces the Rujakara, pain, persisting pain. Kshiprani Vidhamatrani, Nanti Kalantara cha. Kshipra Marma also are considered as a Kalantara Pranahara Marma. Marmani, Marma Sira, Mamsa Sira Smayu Samhyasti Sanipataha, Teshu Swabhava Deva Visheshena Pranaha Tishtanti. Tasmat marmasu abhyatan tan bhavan apadyante. Now, idea of a vital point. Now, according to Sushruta, a vital point is the area where the anatomy is complex, where you have multiple varieties of the structures as such. So, and when there are multiple structures like the blood vessels, nerves, and so on, and bones, and so on, and they are arranged in such a way that there is a possibility of easy trauma. That's what's called as the vital points. Now, in the current surgical point of view, we use certain areas of the body as surgically sensitive parts of the body. It's not, we are not considering them as the vital areas, rather they are considered as surgically sensitive areas. Surgically sensitive areas are those where the anatomy is complex. Again, it suggests about the complex anatomy. And because of the complexity of the anatomy, the possibility of the complications are more. And that complexity also is based upon the idea like whether there is a possibility of collateral circulation at that area or not. To give an example, in case of the lower limb, the muscles of the thigh would have a good collateral circulation. Collateral vessel, there is a circumflex artery, and then the muscles of the anterior and the posterior compartment of the thigh have a good exchange of the blood vessels. Whereas in the popliteal fossa, there is virtually no collateral circulation. The vessels are just blank, straight vessels with a very minimal branches, right? And virtually there is no collateral circulation. Whereas again in the knee below that, there again you have a collateral circulation, and better collateral circulation is there. So a injury at the thigh or the knee would have a better chance of recovery, whereas or the lower limb, lower leg part beyond the knee have a better chance of the survival. Whereas at the knee joint, if a trauma has occurred in the knee joint and the blood vessels that are affected, the complications will be more severe. See, a compression injury, right, like a compression trauma at the thigh, it may heal much better. If a compression trauma at the calf muscle area also has a better chance of healing. But a compression at the exactly at the knee, at the popliteal fossa area, a moderate compression can produce a gangrene, the whole gangrene of the next part of the body, because virtually there is no collateral circulation, and the collateral circulation is the least. Now that's exactly the point. Like when there is this kind of a complexity of the anatomy, the impact of the trauma can be wide varying depending upon the facts of the anatomy. And when Sushruta says Mansasira Snai Sandhi Sannipataha, this again is the reflection, the idea of having this complexity of the structure, and all these facts have to be kept in mind. And there, the theory is Teshu Pranaha Tishtandi. The vitality of the part of the body is located at that point. Now, when we say the vitality of the point, again, it also depends upon certain of the complex reflexes. To give an example again, from the current surgical point of view, the anal sphincters, the sensitive area, sensory nerve fibers in the anal sphincters, they have a close relationship with the vagal component. And whenever you do a parectal examination, suppose if there is a more pain, it can produce a sudden shock. See, when you do the parectal examination and in a patient with this fissure in ano, that pain produced at that level can produce a sudden shock, and the risk is more. Or in case of boxing, the impact on the solar plexus or the abdominal area is prohibited, because a slight compression at that area can produce a immediate loss of consciousness. Shock can be produced. So the point is, the possibility of incidence of the shock in those areas, even due to a minimal injury, can be quite huge because of the complexity of the anatomy. So that doesn't mean that the life is or prana is located at that area. See, you cannot say that your life is located in the anus, because the possibility of shock in the anus, due to the injury at the anus is more. That's not the truth. But the other way, the impact of the injury at that area can produce an immediate shock. That's all the point. And this is because of the complexity of the anatomy, or maybe the interrelationship of the different organs of the body. So on, and you can give hundreds of such examples of those areas of the body where the impact could be quite significant. I have given two examples, like solar plexus and the anal reflexes, and these are usually these are to be considered when you do the clinical examination in the regular clinical practice. You need to keep these in mind. Or maybe another example which is used in the judiciary, or maybe in the your medicine related to the jurisprudence, is in the impact of the injury at the cervical vertebra, like hanging. See, a injury at the cervical vertebra can produce a complete hemisection of the spinal cord at the base of the brain itself, and that can produce immediate death. Whereas a injury below or above may not produce immediate death. So that's the sensitive area of the body, the cervical vertebral body, and cervical second and first vertebral bodies, lateral and axis, which they tend to fuse together, or which may get fractured during the hanging, producing instantaneous death. Now, these are all the idea of what we consider as the marma, or this have to be kept in mind when we discuss or refer to the definition of marma as Mansasira Snayasti Sandhi Sannipataha. Not necessary that you have more structures. Rather, it's also true that these structures could be having some impact on the vitality of the body, and that's why Sushruta says that prana tishtati, where the prana are located, and marma sabhyatan tan bhavana padyante. Then furthermore theory is satya pranaharani agnayani agni guneshu ashu kshineshu kshapayanti. Now, because the Agneya Guna is more in the Satya Pranahara area, the immediate impact would be there on the body, and it produces fatal complications. Of course, from the current principle point of view, you may not have any equivalent theories about that. So, you just keep it in mind, and this fact has to be kept as such, and we have to understand as such. Kalantara Pranaharani, Saumya Agneyani, when there is both Saumya and Agneya component in the area, that's producing Kalantara Pranahara effect. Agniguneshu Ashu Kshineshu Kramena cha Somaguneshu Kalantarena Shapayati. Initially, the Agniguna would be the Agniguna is the capacity to retain the heat of the body, or maybe the metabolic activity, and Somaguna the anabolic component of the body. As these are affected one by one, it may the patient may survive for a longer duration, but in due course of time it may produce fatal. Vishalya Pranaharani Vayavyani, Vishalyagna are Vayavya, and Shalyamukhavruddha Yavadantar Vayushistadi Tamad Jivati, Tad Buddhista Mantra the Shalya Marmastanashika Vayu Nishkramati, Tasmat the Shalya Jivati, Buddha the Shalyam Liyate. Now, this, as I told you earlier, we refer to this issue about the Vishalyagnamarma. The whole idea of Vishalyagnamarma is something unique, where the Shalya as such would be blocking that movement of the vitality, and if you remove the Shalya, it produces fatal complications. Of course, from the current point of view, you do not have that kind of a concept. We have to accept it as such. No such comparisons from the current physiology point of view. Vaikalakarani Saumyani, the Vaikalakara are Saumya, Somohi, Stiratvat, Shaityacha, Pranavalambaram Karoti, where it may result in atrophy. If there is an injury to the Vaikalakarma, it may result in atrophy of the tissue. This you can again see in most of the vascular structures, majority of the vascular structures. When there is a injury, in due course of time, it may result in atrophy of the structures supplied by those vessels. Rujakarani, Agnivayu Visheshadasya Rujakaro, Panchabhutikim, Rujam Ahundeke. The Rujakara, those which produce more severe pain, they are Agni Vayu Guna prominent, and or maybe some people say that it's a Panchabhutika. Kechidahu, Mamsadinam, Panjanam, Samastanam, Vivruddhanam, Samavayatu, Satyapranharani, Yekahinanam, Alpanam, Kalantara Pranharani, Dvihinanam, Vishalya Pranaharani, Trihinanam, Vaikalakarani, Ekasmine Varjakarani, Naivam, Yato Astimarmasu Abhyateshu Shonitagamanam Bhavati. Now, there was, in Sushruta period, there was a difference of opinion. The other difference of opinion was some of the other scientists of Sushruta period, they had considered that a Satya Pranahara Marma would have all the 5 components like Mamsa, Sirasna, etc. Whereas if there is one is lesser, that becomes Kalantara Pranahara, which has 3 components, would have Vishalya Pranahara, which has 2 components, would be Vaikalakara, which has only 1 component, would be Rajakara. But that's not accepted by Sushruta. Sushruta clearly says, Naivam, this is not true. Chaturvidha yastu sira sharire prayena marmasu sannivistaha snayasti mamsani tathaiva sandhien sandapya deham pratyapayanti. Tasakshate marmanitaha pravruddhaha samantato vayuhu abhistranoti vivardhamanastu samatarishva rujaha sutivraha pratunoti kaye ruja vibhutam tasashariram praliyate nashyati chasya samnya atohi shabdam vinihartu michan marmani yatnena pariksha karsheta etena shesham vyakshyatam. Now, Sushruta has given a very clear idea, like a pain is an essential component of every marmanata. Whenever there is a trauma, pain would be essentially there. The first of the reaction, first of the sense of injury is the pain sensation. And that pain sensation is produced due to the vata. And vata is affected as a result of the injury to the other structures of the body. The siras, they may be affected immediately after trauma, or snayus, simamsa, these also may be affected due to the trauma. But at the end, once there is a kshata or injury, it results in vayu, abnormality of the vayu, and the abnormal vata would result in producing the pain, and hence in every condition, pain is felt. So you cannot say that because it is a pain, it's Rujakara. So here, when we say Rujakara, we have to consider the long-term impact of the same, a pain which is not easily yielding to the treatment, or which can persist for a longer duration, that has to be considered as a Rujakara Marma, not simply the pain as such. तत्र सद्यप्राणहरम् अन्ते विद्धं कालान्तरेण मारयति, कालान्तरप्राणहरम् अन्ते विद्धं वैकल्यम् आपादयति, विषयलग्नं वैकल्यकरं च भवति, वैकल्यकरं कालान्तरेण क्लेशयति, रुजां च करोति, रुजाकरम् अतीव्रवेदनं भवति. Now, the impact of the trauma also would be depending upon the severity of the trauma. If the trauma is severe, or whether the point, the vital point is exactly hit, or whether it is hit in the periphery. This also is producing the impact. Like a Sadhya Pranahara Marma impacted with a relatively low intensity impact. It may not result in Sadhya Pranahara, it may result in Kalantar Pranahara. Or similarly, Sadhya Pranahara Ante Viddham, it can be, that word Ante Viddham could be interpreted in two ways. One is about the proximity. If the point is not, the exact point is not hit, but if it's the surroundings, Ante Viddha could be hit in the surroundings, or it also could be having the meaning of a low intensity impact. The impact is lower. The consequences would be of lesser intensity. Sadhya Pranahara Marma may result in Kalantar Pranahara and so on. So the intensity would be gradually reducing. Sadhya Pranaharani Sattaratrabhyantarat Marayanti, Kalantar Pranaharani Pakshat Nasatva, Teshwapi tu Kshiprani Kadachit Ashmarayati, Vishalya Pranaharani Vaikalakarani Kadachita Abhyatani Marayanti. Now, the other way definition of Sadhya Pranahara is it produces a fatal complication within 1 week. Now, with the life-saving measures which we have, intensive care units and the other facilities which we have, patients can survive for a longer duration even in such issues. So, that time duration of 7 days or 15 days of Kalantar Pranahara may not be a practicable issue or a real issue in the current situation where you have the facilities. In the absence of such facilities, the whatever social has considered had to be accepted as such. And now further on we will go into the details of each of the marma as such. I think we will continue with this in the next session. The next part would be about the details of each of the marma in the next session. So we will conclude today. If there are any questions, we will try to answer and then conclude time. So, right. Now there are no questions, so right, we will conclude. Thank you.